Yeah. So the first case that we are going to discuss is cervical smear in trans man. All right. Before we discuss this case, I'm going to ask you some questions, and then we will learn few facts about cervical smear. What are the indications, and what are the eligibility criteria for having cervical smear? Okay. After knowing the facts, you will be able to understand cervical smear. You will be able to counsel any patient who is asking for cervical smear. You will be able to understand when do I need to ask about cervical smear in some specific cases. Okay? All right. My question is, what is the difference between trans man and trans woman? Who is trans man and who is trans woman?
The trans man is originally female and currently they're man,
Okay, good.
and the opposite
All right.
for
So just to avoid confusions, trans man, he's man now. Okay, man, he is man now, but previously he was a woman. Okay, trans woman, she is woman now, but previously was a man. Okay, so what is he now? All right, trans man, so he's now man, previously is the opposite gender. Okay. Okay, so can we do cervical smear in trans man? He is man now, but previously was a female.
If they didn't remove the cervix, then yes.
Yes, we can. Okay, based on the presence of the cervix. So how do we know that they have cervix or not?
Ask them if they underwent a surgical transition.
Yeah, most of people who are in the process of transition, they have either medical treatment, all right, or surgical treatment. The surgical correction is, removal of the, if they want to be man, so they will have a surgical correction of the breast, surgical correction of the internal organs, internal productive organs and external productive organs. Okay, so in the process they might take out the uterus, the ovaries, and the cervix. If they do, if they don't have the cervix, so they don't have the risk of having cervical smear. But if they still have the cervix, they didn't have the surgical correction yet, then they still have the cervical cancer risk. Okay. All right. So in this specific case, a patient usually comes asking for an advice regarding cervical smear, whether it's indicated in his case or not. Does he need to do the cervical smear or not? Some questions. Then you counsel him based on your knowledge about this issue or this entity. Okay. So it's a counseling case. We are following the counseling structure. We recap what's written in the question, and then we understand some information about the patient, asking him some questions which is relevant to the specific concern, and then we counsel them based on their concern. Please be all ears. Listen carefully to what the patient wants. Please understand the question that the patient wants. Okay? In the management, I've included all of the supportive words that you can use, all of the points that you can discuss in this specific case, but all depends on the patient's questions. You can choose the paragraphs that you can discuss or talk about based on the patient's concern and the patient's questions. Let's say that the patient wants to know how it's done, how the smear can be done, how it's done, doctor. Alright, so you answer him based on that. You just pick up this paragraph and explain to him what should be done. Okay, how the PLAB smear can be taken and what's usually happen during the procedure. Okay, let's say that he asks you about what? Is it painful? Is it uncomfortable? Anything that I expect? So you can tell him, well, because you are on treatment, if he is taking treatment, because you are on testosterone, it can lead to some vaginal atrophy and it can be more uncomfortable. So we can give you some treatment, a medical treatment, a topical treatment before, so it can, ease the process. And alleviate uncomfortable, being uncomfortable. Okay. What else? If the patient doesn't bother about anything, he's just coming, asking you whether he's eligible or not. He is not showing any verbal or non-verbal clues that he is bothered. He is sensitive. He feels like he's embarrassed and all of these. If he doesn't show anything, then you don't need to be very supportive. You don't be give him some supportive words. I know how it is difficult. I know how it's uncomfortable. I know how. No. He doesn't bother about anything. He's just coming, taking an advice, asking you some questions, and you answer his questions. All right. So please, don't deal with the case in an awkward manner. Okay. If the patient embarrassed, he feels like this is a sensitive situation, he doesn't like it, he doesn't want it, then you can be supportive. All right. You can tell him, thank you for coming today. We really appreciate that you raised this concern. I want to reassure you that we provide the care with all respect for all of the identity, and we are inclusive. Okay, so you can show some support, and you can show some tone of voice that can help to ease this situation. Okay, so all depends on the situation. Don't be scripted. Don't feel awkward. Okay. Until now, is everything clear? Is everything clear? Yes or no? Just yes in the chat box. All right, good. All right, glad to hear that. All right, so this is the first thing that you have to know about this case. What are the facts about cervical smear, and then we can discuss the case quickly. So if we can just see the nice guidelines regarding cervical smear here. So every person who has a cervix and is within the screening age, so everyone who has a cervix with the age of between 25 and 64 is eligible to have the NHS screening. The first fact that the NHS provide a screening test to every person who has cervix. Every patient who is assigned in the GP as a female or non-binary. Okay? Any person who is assigned in the GP as a female or non-binary, then they automatically get a letter at their home if the patient between 25 and 64 years old. This letter is an invitation for having a cervical smear, free cervical smear. Okay? Why? To screen for cervical cancer. All right? in this smear, they take also the checking for human papillomavirus. What is the main cause or the main risk factor of having cervical cancer is human papillomavirus. So they check also the risk of the patient if he has human papillomavirus or not. Okay, and based on the findings, they will provide the care and they will provide the plan. Okay. Well, if the patient is sexually inactive, does that omit them or take them out from the cervical screening? Yes or no? No, it doesn't omit them. All right? They still can have their cervical screening. All right? What else? If the patient is a trans man, so a transgender man, we've discussed that. This transgender man, he's man now, but he was a female. All right? If he's still registered as a female in the clinic or in the GP, they will automatically will have the letter. Okay? If they changed their sex and their gender to male in the GP, then they will not get the letter. Okay? What else? If a trans man who has a cervix, he has a cervix, but he's assigned now in the GP as a male, so they don't get the letter. If he wants to have the cervical smear, he has the cervix. Can he have it? Yes. He asks the GP to have the cervical smear because he has the cervix. The GP will manually change the lettering system to send him an invitation. Okay? Until now, is everything clear? All of this information is just for you to be able to answer any question that can come up while the patient is asking. Is everything clear until now? Yes or no? Hopefully yes. Yes. Good. All right. Okay? All right. So we have a base now. All right? We understand what's trans man, what's trans woman, what is the cervical screening, who can do the cervical screening, is a trans man can have a cervical screening, and when. All of that have been discussed. All right? Okay. Can anyone withdraw himself or herself from the cervical screening? Yes, they can withdraw themselves. It's fine. They can refuse it, and if they don't want, then they don't want. But you as a doctor, you have a duty towards them to explain to them that cervical smear is one of the screening tests to prevent or to find out the risks of having cervical cancer, to prevent developing any cervical cancer in the future. Okay? If they know that and they still don't want, refuse, it's fine, no pressure. They understand, no pressure at all. Okay? All right. Dr. Rufaida, doctor, if a trans man, so his external genitals is a female and he has vagina. So yeah, trans man, he's a man now. Okay? But the previous sex was a female. He might be having the external genitalia. He might be having a surgical correction of the external organs without the internal organs. So you have to ask what surgery that he had. Did they do a correction for the external organs, or how he is a man now? From his voice, usually they take testosterone, doctor. They usually take testosterone, changing their voice, changing their body character, their hair distribution. So, yes, hormones. They can take hormones, all right, and after that they can do the surgery afterwards, all right. Okay. Okay, so in this case, in this particular case, you are dealing with a patient who is a trans man. Usually, how to know from the question, they give you that the patient registered as a female, or the name, the registration name is Mrs. blah 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 blah. He's under the transition. If they don't give you under the transition, at least you know that he's registered as a female. Okay, his birth name is a female. Okay, and once you enter the cubicle, you find a patient who is trans or a man. Okay, haircut showing that he's externally man. The first thing that you have to ask in these patients, please, what would you like me to call you? If you don't do that in any case that you are practicing in PLAB 2, please do that here. What would you like me to call you? And please, if you say, can I call you blah 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 today, avoid that in this case. Alright? What would you like me to call you? Yeah? What would you like me to call you? He tells you, then call his name throughout the case. Alright? He tells you, doctor, alright, I'm just asking if I'm eligible, or whether I can get the cervical screening or not. Then you tell him, well, okay, I can see that you are concerned about that. So can I ask you some questions about that? So why you are concerned about this question exactly? I mean, why do you think that you are not eligible of having cervical smear? Then he tells you, well, I'm trans, if it's not written in the question. All right? If it's written in the question that he's under transition, then you understand the situation. You understand the situation. So you tell him, all right, I do understand from my notes that you are under transition, and I do understand why you are concerned about this. So please be relevant. Okay? Use the information in the question to help you in having a very nice rapport with the patient. Okay? Then you ask him some questions to be able to counsel him. Okay? Alright, you can tell him, I can see that your name still is in the GB this name. Alright, so I think you are still registered as the different or the previous gender. The previous gender. Okay? Do not tell him, alright, as a female. Okay? Just be aware of the words that comes out from your mouth. Yeah? Okay? The previous gender. Is that right? Yes, doctor, I'm still registered as the previous gender or as a female. Alright, I do understand that. Okay. So, are you currently on any medications, or did you have any surgical corrections at all? Yes, doctor, I'm on testosterone or the voice therapy or whatever he's doing, but he didn't have a surgery. He didn't take the uterus out or the cervix out. Okay? If he has a surgery, so ask him, what is the surgery? Do you still have this a cervix or not? Yeah? These are the relevant questions. This is in the present history. In the past history, have you had any cervical smears before? And usually this patient is 25 years old. This is the first cervical smear for him. So he doesn't know, and he was not aware, and he didn't have any cervical smear. Okay? You can ask this question if the patient is, above 25. Yeah? Any medical conditions that you have, any medications that you are on, if you didn't ask about, hormonal treatment. Family history is not important, to be honest. No need. Okay? Then, you can ask about the sexual history. Why do you need to ask about sexual history? Sexual history is one of the risk factors of having cervical cancer. Okay? Human papilloma virus. Okay? So, are you sexually active? Do you use any protections or not? Okay? You can ask with a stable partner if you want. If you don't want, it's fine. Okay? But the sexual history. Are you sexually active? Do you use protection while having sex? And that's it. Okay, if he's sexually inactive, does that mean that he's not going to have the screen? No, he can have the screen still. Okay, he has lower risk of having cervical cancer, but he still can perform or can do undergo the procedure. All right. Psychosocial, you can include this part if you feel that the patient is embarrassed, the patient is uncomfortable, the patient is showing non-verbal clues that he's uncomfortable, and this is a sensitive issue to him. Okay, you can tell him, well, okay, do you feel supported at all during the journey? How do you feel about discussing this issue? All right. Sometimes people who are under trans, they still have residuals of gender dysphoria. Okay, any trans man or any trans woman, they previously were having gender dysphoria. Okay, they might be still having this issue. So how do you feel about discussing this issue? Okay, with a nice tone of voice and nice facial expressions. Okay, if you are not going to ask these questions appropriately with nice body language and nice facial expression, don't ask these questions. Okay. Especially if the patient is okayish. He doesn't show any verbal or non-verbal clues that he's uncomfortable talking about this. Yeah, ideas, concerns, expectations. Ask the patient, what's your ideas about cervical screen? What's your concern exactly? Any expectations at all? No need for examination in this case, investigations as well. Then you can discuss with him the cervical screening based on his questions. What are the possible questions that he can raise? Am I eligible to have this cervical screening? So what's your answer? Regarding your question, yes, you are eligible to have cervical screen because you still have the cervix. If you have the cervix, you still have the risk of having cervical cancer. So yes, you are eligible to have the cervical screen. Okay, how it's done? You explain. It's a quick test where a gentle, we gently collect some cells from the cervix. Okay, it sometimes feels uncomfortable, but it is not painful. All right, we just open the cervix open the vagina with a specific device called the speculum to visualize the cervix, and we collect a sample from the cervix with a tool. All right, and we just examine the sample under the microscope. Okay, so this is how you answer this question. Okay, if he tells, is it uncomfortable, is it painful? Well, it is not painful, it is uncomfortable, and because you are taking testosterone, you might have some vaginal atrophy. So while we are inserting the tool, which is the speculum, to visualize the cervix, it will feel uncomfortable more than usual. So we can give you treatment beforehand to make the procedure more comfortable. Okay. What else? If he tells you, doctor, I don't feel comfortable having this test, I don't feel like I want to do it, then tell him, oh, okay, I can see that you're uncomfortable having this, and this is maybe emotionally and physically can affect you. I can see how it's maybe difficult on you, but my duty as a doctor just to explain to you that this test is important for you as long as you have cervix, and as I explained, it's prevention, as a kind of prevention of having cervical cancer. We can do some adjustments if you want. we can just provide you with the specific, you know, the health professional that you are going to have the test with should be comfortable with you. Maybe if you want a man, we can do that if you want. We can use smaller speculum if you know, if we find that the vagina is atrophic. We can use smaller speculum. We can do some adjustments to help you if you would like. No, doctor, I don't want. Then okay, no worries at all. We understand that. As long as you understand the risks and benefits, we cannot pressure you at all. You just need to write down or to sign a form that you are refusing the cervical smear, and it's totally fine. Okay, so it depends on you know, the person or the patient himself. Okay, maybe he doesn't refuse. He's just coming to take an advice, ask you some questions to know more about the cervical smear, and is he eligible or not, what should be done, what the test includes, and that's it. He might be refusing. All right. When I teach you, doctors, I teach you all the possibilities. I cannot tell you, well, the patient will come, he will be wearing this, he will be doing this, he will be saying this, he will be asking this question and this question and this question. These are the answers. And when you go to the exam, deal with a different situation. Maybe the patient asks you other questions. Maybe the patient showing you some non-verbal clues. Then you can't deal with the case properly. Alright? So be open-minded. Listen to the facts. Know the facts. Have the knowledge. Go with all confidence and deal with all flexibility. Alright, doctors? Any question in this case? Any question before we move? All good. Okay. Glad to hear that.